So you have a missing tooth. There are numerous ways that you can have that replaced. One of them is via a fixed implant. An implant is a titanium structure which is attached to the jawbone. That is built up and a crown is put on top of it. The combination together will give you years and years of dependable use.
This is an actual implant. The grayish surface is titanium, as is the implant. The shiny surface is an insertion device manufactured to help handle the implant. It comes off, as you will see. Thus far, titanium is the only material known that will allow cells in the body tissues, such as gum and bone, to actually fuse with it. The importance of this? The possibility of actually getting a very rigid attachment of the implant to the jawbone, expected to last for life. What this model cannot show is the opening up into the area designed to receive the implant. But what we have here is a very small hole in the gum and jaw, similar to what would be made in the mouth. This is prepared very precisely and carefully under rigid sterile techniques to make sure that the living cells around the implant are not damaged in any way. As a bonus, this translates into minimal discomfort afterwards. The implant is inserted with a variety of insertion tools, as we will see here. The insertion device is then removed with this fine screwdriver, leaving the implant located nicely in the jaw, with the top just below the gum line. At this point, the implant opening in the top is covered over with a small removable cover screw. This allows us to return the gum back over the implant while waiting a few months for the jaw to fuse with the implant. At the next appointment, after a little freezing, the cover screw itself is removed and a healing abutment is attached to the implant to hold open the gum and allow it to form ideal contours for a couple of weeks. The same as a keeper does for ear piercings. Any procedure beyond this will no longer require any freezing, as they are totally comfortable, the same as changing earrings. 2 weeks have now gone by and the gum has healed nicely. We then remove the healing abutment, insert an appropriate final abutment, take impressions, fabricate a permanent crown, and then insert it into place, providing a permanent tooth replacement that could very well outlast the patient. There are times when it is best to avoid a second entry into the implant site a few months later. If the conditions are all right, we can skip the step of the cover screw at the first appointment and go directly to either a healing abutment and wait 2 weeks for the gum healing, or even directly to the final abutment and a temporary crown, and perhaps even impressions in the insertion of a final crown a week later. And how do I know that it can be this comfortable? This image shows 2 implants with crowns in the lower jaw of a patient 2 years post-op. And who is this patient? It's me.